For the last few years, the public has had access to specific information about the spread of COVID-19 inside vulnerable nursing homes and assisted living facilities. But now, with the expiration of the COVID-19 public health emergency, this kind of detailed data is not as readily available. Investigator Avery Travis takes an in-depth look at what's changed.
Josh, a viewer reached out asking us to look into an outbreak of cases at an Austin skilled nursing facility. That's when we discovered this dashboard, which used to show the number of cases at each of the city's more than 30 long-term care facilities, was no longer online. Now Austin Public Health only shows the aggregate number of cases in long-term care citywide. APH told us it streamlined its COVID-19 dashboard and consolidated some information after the public health emergency expired in May. A spokesperson said, instead of focusing on case counts, public health officials believe there's more value in tracking hospitalizations, deaths, and other indicators, such as wastewater. We also checked in with Texas Health and Human Services, which had been publishing case counts for facilities across the state pretty regularly. A spokesperson said, with the expiration of the emergency rules, it's no longer collecting this kind of detailed COVID-19 data from facilities. But nursing facilities are still required to report any outbreaks to HHSC for possible investigation. The spokesperson also pointed out nursing facilities do report some weekly COVID data to the CDC at the federal level. That is available to the public online. But keep in mind that only applies to skilled nursing homes and not to the state's more than 2,000 assisted living facilities. Now, the state and city didn't always offer up this type of detailed facility level data. During the pandemic, our team actually spent months independently tracking cases and confirming outbreaks at local facilities to report to the public. Our requests and those of other media outlets and even advocacy groups were repeatedly denied by the state. That is until the summer of 2020, when the Attorney General ruled the name and location of facilities with COVID-19 cases does not qualify as personally identifiable protected health information. Then in 2021, legislators passed a law requiring information about facilities where residents have been diagnosed with a communicable disease to be made public through the Texas Public Information Act. Since nursing homes are still reporting outbreaks of COVID to the state, as we told you, we've requested that information and we'll report what types of records we get back.
Thanks, Avery. This past week, Texas lawmakers passed legislation to expand the state's ban on COVID vaccine mandates. We told you last month about Senate Bill 7. It bans COVID vaccine mandates for private employers in Texas, and there's no exception for hospitals or other health facilities. Governor Abbott is expected to sign the legislation into law. As Texas grows, so does the demand for water. Now voters are being asked to help. The plan on your ballot that could shape the future of the state's water supply. Students with special needs waiting months for services.
She still has received no services since the beginning of school.
We take a deeper dive into overdue special needs evaluations in one Texas school district and uncover the challenge facing parents and students.